Welcome to State Insurance USA Cares podcast, where we celebrate the heart of our communities. Each episode, we highlight local charities and nonprofits who are bringing hope, help, and healing to those who need it most. Get ready to be inspired by the amazing stories of people making a difference, because together, we care.
Well, hello, my name is Gail Langner. I'm with State Insurance Cares, an arm of State Insurance USA. I am thrilled today to have Jennifer Thrash on with us. She's the Director of Philanthropy for Hope Healthcare. And Jennifer, thank you so much for joining us today. I appreciate it.
Thanks for the invitation.
Absolutely. Well, I was thrilled to know that you have, that you touch of Charlotte County, Collier, Lee, Hendry, Glades. That's a big area to be in charge of. I can tell you that my husband actually passed away at Joanne's house in Bonita 11 years ago. And so I am familiar with the Hope Hospice arm of Hope Healthcare, but I know that you do a lot more other than the hospice part of it. Could you explain to our listeners today exactly everything that you do, what it encompasses?
We do cover a lot, as you mentioned, and Joanne's house is one of 4 hospice houses that we currently have. We have one in Fort Myers, one in Lehigh, and one in Cape Coral as well. But beyond our hospice care into the health care of Hope Healthcare, we provide bereavement services to everyone in the community. You don't even have to have gone through any of our programs. We offer that to everyone. And I will say we offer on average over 10,000 hours of bereavement services each year to our probably about 1,500 individual participants. Some obviously use our resources longer than others. And that's fine. We provide that service for 18 months after a death. And it doesn't have to be, it could be a death of a grandparent. It could be a death of a pet. It's not just focused on a loss of a spouse, which of course we do cover. So besides our bereavement services, we are somewhat unique in providing hospice care and palliative care for kids. So not an industry necessarily many are in, but we do serve kids from babies, neonatal to 21 to the age 21. And so many of them may have cancer diagnoses, but this is obviously a population that we provide that needs a lot more services than typical hospice provides. And so this is an area that we fundraise for quite a bit. We currently serve between 60 and 100 families. We are in the process of expanding that program. We just received a $150,000 grant to have a liaison that supports our work with the Golisano Children's Hospital. We've already had a great partnership with them, but that will help augment our work. And these are probably our neediest patients in terms of the services. And we provide music and art therapy, and those are costs that are not typically covered by Medicare and Medicaid.
Right.
And this is something we've been well known for the last 40 years that we've served the community. So you talked a little bit about our hospice services, which we do provide in Lee, Hendry, and Glades County. We also have another program that I should highlight, and that's our PACE program. And that's program for all-inclusive care of the elderly. And that is a pretty unique program as well. I liken it to adult daycare, but we provide so many more services. For instance, we become their insurance provider. And so we provide, they need a specialist, maybe see a pediatrist or a cardiologist. We provide all their health care. And many of them are homebound, low income, 55 and older in our community. And this PACE program helps support about 360 some participants on an annual basis. And that program is growing by leaps and bounds. We provide that program in Charlotte County, Collier County, Lee County, of course, and then I'm missing one county. I'll come up with it.
Okay.
So PACE is in a number of our communities as well. And that program is a star program, and we're expanding that throughout the state, not through Hope, but we are affiliated with Chapters Health. And so Chapters Health is expanding that program throughout the other affiliates in the state. And it's a wonderful program for people who are participating. They should check out our PACE social media. There's some great stories there. And beyond PACE, we also have a Valor program. So we're honoring our veterans and first responders. And we have many in the Southwest Florida community. We do pinning ceremonies and special certifications and honor guard services for just to honor those who have served overseas and domestically as well.
Okay. Incredible. So I'm sure you're working with other organizations. Let me give you, well, you did bring up Golisano with the kids care. Anybody else that I know that you would be jointly working with?
Yeah, one program I did miss mentioning is our Camp Braveheart, which is part of our bereavement services, and it's a special kids camp where we send anywhere between 30 and 90 kids to a camp once a summer to help support their grief and learning about grief and how to deal with grief. And we partner with Valerie's House as well as a number of other nonprofits in the area that are serving children. So we do like to collaborate. Obviously, Lee Health has been a great partner and referral source for us as well. I'm trying to think of a few others, but throughout our community, we are partnering with a number of organizations as well as statewide. We're part of the PIC program, and I should know what this stands for, but it's it's Partners in Kids Care. And so we do have a number of partners throughout the state as well as locally.
I'm thrilled to hear that. When we decided to do state insurance cares, back in the day, we used to call it Love One Another. Valerie's House was our very first charity that we ever gave to. And I remember visiting there, and I'm sure you've been, right, Jennifer?
I have.
The masks that the kids paint with the colors of how they're feeling, like blue means something, yellow means something. Yeah. But the thing that got me crying before I even left was she showed us the inside of the mask, and the kids would paint that, showing how they felt on the inside, things that they don't share with others. And many of the kids felt guilt that their mom had passed away or whatever. It's like, oh my gosh, so that's a wonderful thing that you're doing, Jennifer. It really is. Where's the camp held?
This past year, it was at Camp Impact, which is over by Okeechobee, but it has moved around. It used to be called Rainbow Kids Camp, but this year, as our affiliation with Chapters 3 years ago, we are now calling it Camp Braveheart. But so they're going on throughout the state as well. And I will say Suncoast was a huge help for that camp this year. They supplied a $30,000 grant for a number of the affiliates throughout the state who do Camp Braveheart. So as we talk about partnerships, we have funding partners too that are very important to our work.
Isn't it incredible how generous people can be? Truly.
Yes.
Incredible. Southwest Florida, I'm not from here originally, and I was just blown away to find out how generous people really, really are in this area. Just incredible. It seems like you have a volunteer program as well. Is that right?
We do. Yes, we have
a
volunteer.
How does that work?
We have right now about 250, like most nonprofits. After COVID, they kind of their volunteer programs took a dip. Ours is building back, and so we're really excited. We had recently just had a celebration. So our volunteer program is amazing. I would say probably about 5% is patient-facing services, but such as we have a pet therapy program, so we're bringing dogs into people's homes. So when we talk about hospice care and serving 700, they're not all located in our hospice houses. I would say about 95% of our patients we do serve in the home or assisted living facility, skilled nursing facility. So we're not just in our hospice houses. And due to Medicare and Medicaid and all of their different algorithms and changes, we do serve quite a few people in their homes. And so our pet therapy program, we have a few that have been with us for a number of years, and they go out to the homes. And I just saw an article from our volunteer newsletter that talked about these 3 golden retrievers going out. They also do visit our hospice houses. So, and the Valor program that I mentioned earlier is also one of our volunteer driven programs. And so we're building that back up. If people want to get involved, we have a lot of opportunities right now to get involved, doing some bedside, going in and just talking to people. Oftentimes people are homebound and they need someone to talk to. Right. And so our volunteer program is very impactful in terms of providing that service to our elderly in the community.
Well, I know that I hear throughout Southwest Florida, friends will even say that they're bored or they just need something to do or whatever. If they were to sign up to be a volunteer, how would that work, like hours wise? Would it be you would sign up for 2 hours a week, or how would that work?
Very flexible. We have some needs, like sometimes people want to do administrative stuff. So we have 2 days a week where we ask volunteers to come in and help support that. We also have volunteer needs at our hospice houses to greet people when they come in and make them feel welcome and help direct them. And so those are needs that we have Monday through Friday, but also on the weekend, we have needs for those. Our website, you can sign up on the hopehcs.org site. You can sign up to volunteer. I'm trying to think of other opportunities, patient facing, our Valor program, which I mentioned. What else? So they can really opt into how many hours they want, which was your question that you asked.
Yes, it is. Right.
And we do have people who are obviously they travel back up north. So we can work through that. There's some qualifications and legal hoops you have to jump through, so to speak. But that's everywhere nowadays.
Right. That's wonderful. Well, Jennifer, I'm just overwhelmed with the amount of wonderful things that you're doing here. It's way more than I even had anticipated. So I really appreciate everything you do. And of course, State Insurance Cares was happy to help in any way that we could. So if somebody wanted to reach out in any way, whether it's to donate or whatever, what is your website?
It is hopehcshealthcareservices.org.
Okay.
And so, yep, all of our information is on there. And I want to say thank you for State Insurance support as well, because it is very impactful. $500, $100. That goes to support things that are not covered by Medicare and Medicaid, which much of hospice care is. However, it's the extras. It's the massage therapy, the art, the music therapies, the pet therapy programs. It's those programs that are directly impacting our patients, and really helps with quality of life, end of life care, being able to provide those services. So thank you.
Well, absolutely. We're happy to help in any way we could. So thanks so much again for taking some time to be on the podcast today, and look forward to doing a check presentation with you tomorrow.
Yes.
Right. All right. Thank you. Have a wonderful day. We'll see you then.
Thanks, Gail.
Thank you for joining us on State Insurance USA Cares. We hope today's story uplifted and inspired you. If you'd like to support or learn more about the incredible work happening in your community, visit stateinsuranceusa.com or call 239-567-9992. You can also visit CaboWaboGym.com. Until next time, be sure to let your sun shine and keep sharing good and positive vibes wherever the waves take you.